Hi everyone, I'm Dr. Bardia Anvar, Practice President of the Skilled Physicians Group. As you all may be aware, our practice continues to see patients in the skilled nursing facilities throughout the United States during the COVID-19 pandemic. Today is April 2nd, 2020, and we are beginning to see a rise in many cases throughout the United States. What our practice is presently doing is screening all patients prior to being seen via telemedicine, and we are screening for symptoms of coronavirus, which include any respiratory symptoms related to cough or anything else respiratory related. Of course, fever, patients exhibiting fever may be suspected to be positive for COVID-19, and any lethargy or changes in energy in patients are related to COVID-19 or coronavirus. If any of those patients are positive, our physicians will see those patients via telemedicine only. In certain cases, when patients still need urgent procedures or care at the facility, our providers will come in to see those specific patients. We have had to alter the practice of how we see patients in the upcoming weeks, as we know that there is going to be a spike or a rise in the level of patients who will be positive for the virus. Now, what else that we are seeing is that the virus itself is affecting patients who have diabetes, heart disease, respiratory issues, and other chronic illnesses. So we are very careful in screening and taking care of those patients. Patients who have these diseases must have very tight control of their chronic illnesses, such as diabetes, with blood sugar control, hypertension should be controlled, and other medical risk factors to decrease the possible mortality if they do contract the disease. Unfortunately, the disease is out there and it does spread. It does stay on surfaces for quite a while. Therefore, not only is it important to wear protective gear, personal protective equipment, masks, and 95 masks, but also to wipe down surfaces when going in and out of patients' rooms, and we continue to do that in our practice. And to anyone affected by this illness in any way, or your family members, we definitely sympathize with you. We know that this can be a very tough illness to deal with, and we hope that everybody has a speedy recovery, and anybody who has had a loss in the family, our heartfelt sympathies go out to you and condolences. But we know that together we can control the spread of this disease. That is why we are trying to focus primarily on telemedicine in cases where we can. And then, of course, other than that, is stay at home, really not going out so that the disease does not spread. Keeping a 6-foot distance from others if you are interacting with other people, and if you do have the availability of any type of mask or facial protective gear that can protect you from respiratory droplets coming out towards you or respiratory droplets coming out of you towards someone else, I think is important. Something that's not being talked about, but this is another way we can prevent the spread of this disease. And hopefully we will see the disease coming down. Now, next week, we will be having a pretty extensive webinar that we invite anyone who would like to join to come and learn with us about this disease. We're doing extensive research, and of course, this is called a novel virus that we don't know much about, but we're learning more each day, and we will be going over further information next week. For now, I recommend to anyone to stay positive, and to not worry and have significant anxiety about this. Having worry and anxiety can decrease your immune system and your ability to fight the disease, and instead focus on things you can do to increase your immune system and be able to fight this disease if you should contract it. But hopefully with all of these measures, we should not be seeing a rise of people turning positive for this disease if they have not already done so. So thank you very much. This is our message from Skilled Wound Care Skilled Physicians Group. I hope everybody is coping with this well, and we will see you once this is all over. We hope to see everybody in person once again. Thank you.